Welcome to our series on being pregnant in a pandemic. My name is Janaya, and I'm a registered midwife. We are now on video number 5 of a 7-video series. Please take a moment to pause here and read more about it. In addition, if you would take a moment to fill out our anonymous pre-survey, it would help us a lot for information that you would find helpful in your pregnancy in the pandemic, as well as for our research purposes. Between weeks 28 to 26, you can expect phone and in-person visits with your care provider. Although the prenatal visit schedule has been adjusted to minimize unnecessary exposure during the pandemic, your care providers will use their professional and clinical judgment to adjust as necessary for your pregnancy. This adjusted schedule does not put you or your baby at increased risk, but sometimes you might feel like you need more assurance and reassurance that all is well. Kick or movement counts is a great way to check in. Most people start to feel movement between 18 and 20 weeks of pregnancy, although if your placenta is forming at the anterior aspect of your uterus, it may take a couple more weeks to start feeling more pronounced movements. Regardless, now that you're 28 weeks and moving through your 3rd trimester, you should start to notice your own baby's range of normal movements. For some babies, some parents will note that it's like a party animal and constant tap dancer. Other babies move a little bit more like slow dancing or Tai Chi. Regardless, your baby's normal should progress throughout the rest of your pregnancy and even into labor. But if you've had a really busy day, or you've been distracted, or you're concerned that you're feeling fewer movements than normal, or even if you're just feeling anxious and want to check in, doing movement or kick counts is a great way to do that. Remember that if your baby's moving, they are receiving all the oxygenated and nutrient-rich blood from the placenta that they need. Kick counts or movement counts are the gold standard for checking in on their well-being. You want to feel 6 movements in 2 hours. To do this, we recommend drinking a glass of cold water or juice, finding a comfortable position, lying down, sitting, putting your hands on your belly, and counting. If you feel 6 movements even in the first 30 minutes, stop counting. You're done. However, if you don't feel 6 movements by the end of 2 hours, that's a time to check in with your care provider. As your pregnancy progresses, the movements do start to change, and they may feel less pronounced, less like kicks and punches, and more like wiggles and squirms. This is normal. However, like I said, if you do not feel 6 movements in 2 hours, it is a time to call your care provider or go to the hospital to be assessed. Please do not hesitate to page your midwife or present at the hospital for an assessment. What will happen there is called a non-stress test, or an NST. This involves putting some monitors on your belly, one to measure uterine activity and the other to measure your fetal heart rate of your baby. This happens for about 20 minutes and may also be conducted together with an ultrasound to check on your baby's well-being. You can take a moment and watch this other video that's been provided here for you. During 28 to 36 weeks of pregnancy, this schedule will help guide you in terms of what to expect. Preparing, reading resources, phone consults and assessments with your care provider, and then in-person assessments to check on your fetal well-being and growth are what will happen during this stage. This time of pregnancy is also a great time to start thinking about pain management in labor, and your plans and your hopes for the labor. Labor is indeed a lot of work, and they don't call it labor for nothing. But knowing your options of coping methods or pain management in advance gives you time to learn about all the pros and cons or side effects, things that might work for you better than others. You may choose and use one or even all of the methods available. It is your choice and may also depend a lot on how your labor is progressing. Regardless, it is important to understand that the pain intensity of labor is a normal physiological function. Remembering that these uterine contractions are a sign that your body is working normally to birth your baby can be a very important tool to help you get through. Breathing and relaxation methods, massage, and having a reassuring support person can be very helpful in terms of coping with each contraction as it comes, as well as helping your body find a good labor rhythm. Many people find a warm bath provides a lot of relief and comfort as it alleviates some of the gravitational weight and soothes the muscles that are working so hard. It is also much easier to relax in between contractions with this method, embracing the rest in between contractions in order to have the energy to cope with the next wave. The hormones of labor work best when we feel safe and supported, and this looks different for everyone. Knowing you have the options of morphine in early labor or an epidural when labor becomes too much for you in the later stages can be very reassuring. Epidurals are a safe and effective pain relief method, and it might be particularly effective when labor has been long and you are in need of some rest or other interventions to ensure your labor progresses. And of course, you're asking yourself at this time, but when do I go to the hospital? When things aren't normal, when do I go to be assessed? An easy way to remember these, the reasons to go be assessed are the ABCDs. We've already discussed activity, the baby's movements, the normal fetal movements of 6 and 2 hours. So we'll move on to the next. B is for bleeding. If you notice any spotting in your pregnancy, it could be for a number of reasons. Some are benign and they have no effects on your pregnancy. Other reasons are important and more urgent. And that's why it's important to go to the hospital. C is for contractions, or regular or rhythmic period-like cramps. While it is normal in pregnancy to feel aching, cramping, stretching of ligaments, it is not normal for these sensations to be regular and rhythmic or accompanied by any bleeding. Before 36 or 37 weeks, this is considered preterm labor, and you should be assessed immediately. If after 37 weeks, these contractions are coming regularly and strong, it's important to stay at home in the early part of labor, to use some of the early coping methods we talked about in terms of pain management and coping, and wait till your contractions become regular and strong. Often we use the 411 or 511 reminder. So when your contractions are coming every 4 to 5 minutes and are 1 minute long or around 60 seconds long, and that's been going on for an hour, that's usually accompanied by cervical change and considered active labor. And it's a great time then to move to the hospital. D, and as we move through A, B, C, D, is for discharge. Vaginal discharge does change in pregnancy and can become more watery or change in texture. However, if you ever notice a gush of fluid or an ongoing trickle, this is not normal and may be a sign that your water has broken, and also a reason to go be assessed at the hospital. Pay attention to the color and smell of the fluid, as well as to your baby's movements at this time, as these are the questions that will be asked when you present at the hospital. Some frequently asked questions in pregnancy is what to do if I have high blood pressure. How do I know if I have high blood pressure? This is assessed throughout pregnancy and will be assessed at key times throughout your appointments. If you do have high blood pressure, ongoing appointments will be made to monitor it, as well as discussing with you when it is important to go and present to the hospital again. Signs of preeclampsia, when your blood pressure is too high and is putting stress on other organs of your body and can be dangerous for you and your baby, would be signs of a very sudden headache in the front of your head that doesn't go away with Tylenol use, vision changes, or constant upper abdominal pain. These are times to present to the hospital to make sure that your blood pressure and everything else is normal. Another question that's on the minds of everybody is, does COVID-19 cause pregnancy loss? Infection does not appear to cause early pregnancy loss or miscarriage. And although there might be a risk of preterm birth if you are sick with severe symptoms and active illness, we don't believe it to cause any harm to the fetus at this point. This is why it is important to monitor your health and seek health care in a timely manner. If you can take a moment and fill out our anonymous post survey, we would appreciate it, as it helps give us feedback on how to improve information that might be helpful for you in your pregnancy. Don't forget to download the handout found in the description box below, and please fill out the feedback form to tell us how we can better assist you. Congratulations on making it this far. You can now continue on to watch our next video and see what's coming up next for you in your pregnancy. All the best.